Welcome back to our channel. Today, we're diving into the world of cytology and discussing one of the most important screening tests for women, the Pap smear. We'll cover everything you need to know about this test, from its purpose to its impact on health. Pre-test information. Before we get into the specifics of the Pap smear, it's crucial to know that this test should not be taken during menstrual cycles. It's best to schedule your appointment outside of your period to ensure the most accurate results. Specification of test. The Pap smear, also known as the Pap test, is a screening procedure used to detect potentially precancerous and cancerous processes in the cervix, the lower part of the uterus. This test can also identify infections and inflammation. It's a simple, quick, and relatively painless procedure. Diseases associated. The primary purpose of a Pap smear is to screen for cervical cancer. According to the World Health Organization, cervical cancer is the fourth most common cancer among women globally, with approximately 570,000 new cases and 311,000 deaths in 2018 alone. However, screening with the Pap smear has substantially reduced the mortality rate due to this disease. Specimen used. During a Pap smear, the healthcare provider takes a sample of cells from the cervix using a small brush or spatula. These cells are then placed on a slide or in a liquid medium and sent to a laboratory for examination under a microscope. Components include. The components of a Pap smear include preparation. The patient lies on a table and a speculum is inserted into the vagina to open it for better access to the cervix. Sampling. A small brush or spatula is used to gently collect cells from the cervix. Fixation. The collected cells are fixed onto a slide or placed in a liquid medium for preservation. Transportation. The sample is sent to a laboratory for analysis by a pathologist. Test report time. The time it takes to receive your Pap smear results can vary. Generally, it takes about 1–2 weeks to get your test results back. If any abnormalities are detected, your healthcare provider will discuss the next steps with you. Test information. As mentioned earlier, screening with the Pap smear has substantially reduced the mortality rate due to cervical cancer. The American Cancer Society recommends the following screening guidelines. All women should begin cervical cancer screening at age 21. Women aged 21–29 should have a Pap smear every 3 years. Women aged 30–65 should have a Pap smear combined with an HPV test every 5 years, or a Pap smear alone every 3 years. Women over 65–70 years with no abnormal results in the previous 10 years may stop screening. Women who have had a total hysterectomy for non-cancerous causes do not need screening, unless the hysterectomy was done for cervical cancer or pre-cancer. Conclusion. In conclusion, the Pap smear is a vital screening tool that can help detect cervical cancer early when treatment is most effective. It's important to follow the recommended screening guidelines based on your age and medical history. If you have any concerns or questions about the Pap smear or cervical cancer screening, be sure to talk to your healthcare provider. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health-related content. See you next time.